Hello and welcome to YODO. You only die once. I know that sounds like a grim way to look at things, but it's actually very powerful. You do typically only die once. We've seen such a need for education. People have such a fear for serious illness and what happens next that we really wanted to bring some of our knowledge and expertise to other people that would want to learn because they have a need. If you're watching this, there's probably a real reason for you to be watching it, and probably you're having some real serious concerns. And Dr. Tartaglia and myself have a lot of experience with death and dying in our physician practices, and we want to share some information so that you feel empowered.
So tell us why the name You Only Die Once? How did that come about?
So I worked for a hospice company in Missouri many years ago, before the turn of the century, in fact. And YOLO was such a hot topic or hot word, and so many people said, you know, you only live once. And actually, if you're doing it right, you should be living every day. Every moment of every day, you have the opportunity to live. And at the end of that life, just like taxes, you can't avoid it, death comes. And so I feel like you only die once, you live every day. And we want the end of life to be a good one, because there is such a thing as a bad death. No death is, is great, but there are worse ways to die and worse ends of life. And so we only want to die once, and you want that to be the best possible death for that patient. I'm Dr. Bohn. And this is Dr. Tartaglia, and we're going to tell you a little bit about ourselves so that you can become familiar with us, and we want you to be able to reach out and communicate with us because we know that these are frightening topics to discuss.
And we're here to help and support you in any way that we can. So as Dr. Bohn just introduced me, my name is Lisa Tartaglia. I am a dual board certified in family practice as well as hospice and palliative medicine, and I just want to tell you a little bit about myself as to how I became a hospice doctor. You know, the big H word.
Yeah, that's a scary word, hospice.
Yeah. When I was in medical school in the late 90s, early 2000, it was a hot topic to have do not resuscitate orders. That became a thing that never existed before. So I was always kind of drawn to those more difficult and challenging patients, and my colleagues would tell me, you go in and talk about it, you're more comfortable about it. So it just became a natural draw. But really the main reason, and I attribute to becoming a hospice physician, is my grandmother. The day that my graduation party from medical school, which we did things a little backwards, I actually had my party before the actual graduation. I don't know if I ever told you that, but we're Italian. So we had they had a big surprise party at my house, and my grandmother was very ill, and her illness was evolving at the party, and I was very alarmed by this. And then the next morning, I wasn't shocked when my father called me out of the shower and said, Grandma had a major stroke. What my father didn't know, and what still to this day, it's just divinely ordered, and I believe that there is a spirit to help us through things, is my grandmother, a week prior to her getting sick, had me sign all the paperwork to become her healthcare surrogate.
Wow. And
to make her decisions, because she knew that they were going to be tough. So when we arrived at the hospital, my grandmother was not responsive, and she had a massive stroke. And, you know, I'll share more details about that later and that experience and how it made me feel. But what I did for my grandmother is I provided her a natural death.
Yeah.
And I went against the doctors. I went against my family. And I had to win them over. But I provided her the natural death. And in her dying, I realized that there's a lot of teaching to be done and to help normalize death. And then I began a plight, because this is what we do, us physicians, right? So we start these plights that we're going to make things better. And my plight was I was going to become a family practitioner, and I was going to teach people about death and dying and not be afraid of it. So I've been doing hospice work now for 16 years, and I just love every day. And I've been very lucky in the last 2 to 3 years.
So you were just a medical student, and you knew then as a medical student that when your grandmother had this major event that she obviously couldn't recover from, to what she had described to you as a meaningful life,
Right.
You wanted her to be provided a good death, one with dignity and one with respect.
Yes, this was a woman who was the matriarch of our family. I didn't have a grandfather growing up. She was the grandfather and the grandmother on my father's side of the family, and she guided us every step of our way. And she wanted to die peacefully. She did not want to die with machines. And because of my medical school training that I had endured in Florida, at the hospital, it was a big push to have these conversations with very sick people.
That was very forward thinking then.
It really was. And I attribute that to my attending, who was female. And I feel that she always pushed us a little harder and just made us not look at diseases, but look at the people. So I commend her for teaching me to become more well-rounded, because that helped me to be who I am today.
That's a very moving story. I didn't have necessarily a family member that started me in hospice. I was already a resident when I had my first encounter with a do not resuscitate patient, and she was in the hospital for several days and then had gone to a rehab facility and then gone to a nursing home and then come back. And in my family medicine residency in Kansas City, over 3 years, I had encountered this lady multiple times. And so I knew her, she knew me, and she came into the hospital and she told me, I don't want to do this anymore. Every time I come, they want to give me more blood, they want to, run more tests, I have to have IVs, and I can't do it anymore. This is not what I want. So she said, at some point in time, when I can't have all these things done anymore, I want to be allowed to pass naturally. And death is such a word that many people don't use, and so you have to explore, well, when you say you pass, I want to make sure I'm understanding that completely. And that's when she said, yeah, I want to be allowed to die. When she said she wanted to be allowed to die, and die naturally, we put the DNR order in the chart. And the nurses called me early one morning that she was changing, she was declining, she was no longer responding. And so I went and stood at bedside with her and a couple of the other nurses, and we allowed her to pass, and we just stayed with her and held her hand. And the nurses just wept because they said it was so beautiful to allow her to pass without, calling a code, without, ordering for blood or blood gases or trying to do CPR. But that was what she had wanted, and she had made that very, very clear. And so that was one of the many experiences that I had with death.
And this was before hospice even came to hospitals, right?
I don't know if we had hospice back then, because that would have been about 1989. So it was many years ago. And then as a resident, while I was a resident in the hospital, my father came in as a patient and had heart surgery, and he was a do not resuscitate. And what many people don't understand is, how can you be, a heart patient and gonna have heart surgery and have
a do not resuscitate?
Yeah, you can.
You can.
I want, like, for me, I want everything possible done until that moment when it's not gonna be likely to bring me to a quality of life. Because when I die, I only want to die one time, but I want to live every day to a quality of life that, for me, I think is worthwhile. So I had a couple of experiences with death during residency that made me comfortable with it, and I had a similar encounter with my fellow residents that, you're the one who knows how to do this, you go have that talk with them, you're more comfortable. I was one of the only residents that would do house calls and do nursing home visits and take care of patients that were DNR, because some physicians, nurses, they really struggle with that do not resuscitate. That's really hard for them. I don't know if you encountered that.
Yeah, and I think it's because of that oath that we take, right? Do no harm. So a lot of times physicians feel that do no harm also means don't let them die.
Yes. A lot of physicians take it personally.
Personally, yeah.
If
like
the
a
patient,
failure.
Yeah, if I can't, fix this, then I have somehow failed. But I think it's really important for patients to allow their physicians to be human. Don't make them a robot. Let them have emotions. Let them have empathy. Let them, have their own morals, values, and ethics. They shouldn't be making your decisions for you. They are your medical expert and your medical guide. And it's important for you to tell them what's important to you, not have them make the decision for you. Paternalistic practice is gone. And do you know what I'm talking about when I say paternalistic?
Yes.
Me, doctor. I tell you, you just do what I tell you to do.
It's time to take control of your health. And I think what really made Dr. Bohn and I decide to do this channel is we've seen a huge shift in healthcare over the last 24 months with COVID, that a lot of people with serious illnesses have neglected themselves because they couldn't get into a doctor. They were dealing with a pandemic and a health crisis. So they're coming in sicker than ever before. And they just don't know how to handle their disease.
The unfortunate part, many unfortunate parts, but the really unfortunate part for this advanced disease state that we're seeing right now is patients neglected health care or just plain could not get in. Many people were without jobs or without insurances. Many offices were only doing virtual visits. And I think that's great. I'm old enough, I remember the old Ma Bell commercials that the telephone was the next best thing to being there, but it's not like being there. It's not like having someone that's right beside you that you can communicate eye to eye, and then they're going to look in your ears and look in your throat and listen to your heart and listen to your lungs and do a belly exam. You can't get those things done. Now, information transmission is wonderful. Like this venue, people can listen to this and they can get snippets of information, they can get that education, and they feel more empowered. And then when they go to the doctor, it's more smooth for their physician to be able to tell them, because they're already open-minded. They know they have choices. I know I'm not backed into a corner. I feel empowered by the knowledge that I have.
Yeah, and I think that, both of us were very empathetic. We're very caring to a default, and we're really experienced with the process of dying. With our career choice, we see dying almost every day.
Yeah.
So we just feel so important to get the word out, to empower patients and family members and other physicians, nurses.
Primary care physicians. I know I practiced in a small town in mid-Missouri for 25 years. And those primary physicians build such a relationship that is a deep relationship with their patients. And the patients have such respect for that primary care physician. And as palliative physicians, as hospice doctors, we need to build that relationship quickly because we may not have a lot of time. Unfortunately, many patients have been reluctant to hear, or the physician has been reluctant to tell the patient, this is what you're up against. And so you don't have this opportunity to prepare yourself and to brace yourself for what's about to come. And so you're kind of lulled into there's always one more test, there's always one more treatment. And when you go into the hospital room, patients are saying, yeah, I'm just waiting here to hear what the doctor has to say.
And we want
you have that power.
Yeah, we want to give you back the power. We want to teach you all what you need to know so you have control over your process.
Everyone will eventually die. That's the sad truth. But we want to normalize that process so that it's not a taboo thing, that it's some sort of mysterious thing that, people fear. I think we need to have a healthy respect for the end of life, but I don't think that we need to be so afraid of it that we won't talk about it at all. Now, I always tell patients, because I'm now have the privilege to work with veterans in an inpatient care unit, and I tell patients, I don't want to talk about the end of life every time I come in. I want to focus on what's happening in your healthcare because I want to optimize the time you have, and I want to maximize the quality of life that you have. So every now and then I may bring up those topics of end of life, but I'm not going to talk about it every time. I certainly will talk about it anytime you want to bring it up, but I would just want to talk about the now and the future and how can I make your future better.
So important to be empowered to knowing your choices, right?
Yeah.
So then once you have your choices, then you really can live each day to the fullest and not be focusing on the dying. I find, and I'm not sure how you feel, in our patient subset, sometimes it's like the elephant in the room is that death, and they've stopped living because they're so afraid of that next step. So I find when we start discussing that next step, to whatever the comfort level is, then there's a peace over the patients.
But I want my patients to live every day, and I want it to be the best quality of life that they can get every day. And physicians choose this profession because they're educated, they are caring, they want to provide empathy for others. And along the way of practicing medicine, they gain that experience of dealing with different patients and what the patient's goals are. I'm glad to see that shift in healthcare, where now the patient is more of the driver, and we are the medical experts to provide that advice and help the patient as they're on their journey through life, and they're on their quest for having a better day every day.
Now, I will say this, the difference that I see is, yes, patients are more educated and more empowered, but don't you find now, I don't know how it is in your veteran population, but a lot of times the mom and pop, family doctor that's taking care of them at home isn't the one in the hospital.
No.
And there's a breakdown of communication between what's going on in the hospital and what occurred at home.
Right.
So in my job that I work in, I'm kind of bridging that gap, and you can see there's a big disconnect with communication. So that's why, another reason why we want to have this channel, just to help you all.
Because you're the missing link. Patients are the ones who are seeing the doctors in the hospital, and they're the ones that are seeing the physicians in the community. But healthcare in the hospital has gotten so technologically advanced, because now we have the technology now that we can keep people alive, but I'm not certain that people will see that as living. And so I'm alive, but am I living? And that's where you want to live to what your quality of life is, that what you want, and you're the only one that can tell us this is a good quality of life for me. If good quality of life for you is someone that's content to, be in one room and have someone meeting all of your needs and, wiping your backside and wiping your drool and changing the channel on the TV as they refill the feeding tube going in your tummy, but you're not really cognizant or aware of your surroundings, then yes, you're going to be kept alive. But if you're thinking living for me is being able to get from my bedroom to my kitchen to my bathroom, and I've got a couple of plants and I've got a dog and I really want to go outside, I want to do some things, I want to physically be able to do things, that's living for me, then those are conversations that you need to have with your physician about what quality of life really means to you, because you want to live each day.
And I think it's important because there's choices. And a lot of times people think with death and dying, talking about serious illnesses, the choices have ran out. But as you can see, Dr. Bohn,
there's lots of choices,
has told you there's many choices. And whatever your choice is, a great physician will just support you. And that's what our channel is going to be. We're going to support you and show you our areas of expertise and help you be at peace with your decision.
We want to teach and educate people because we want to demystify what happens with serious illness. As I approach the end of life, that's a mystery to me and I'm afraid of it. We want to educate people so that they feel empowered.
So in summary, the reason why we really decided to do this channel,
to do the YODO channel
is just to create an empowerment and show you that you still have choices. Even if you're faced with serious illnesses, sometimes you wake up and you're just not feeling all that great and you feel like you're out of choices. You're not.
You're not. You still have choices. And we're going to try to always be uplifting because we know that this is a kind of a grim topic, really. It's not that we're trying to be lighthearted. We do have a gallows sense of humor that will come out every now and then.
That's
because
true.
It is serious and people do fear it. But we want to demystify it. We want you to live each day to the best that you can possibly live it. And in the words of Sir William Osler, the good physician treats the disease, the great physician treats the patient with the disease. And we want you to be able to live with your disease process, but we don't want it to slow you down.
Yeah. And I just really believe you need to stay tuned and continue to watch more videos as we help guide you through your journey and educate you and empower you with all the choices that are out there.
You can certainly leave comments below. Please do not leave any names or personal information. You can contact us by email in the description that you can reach that information. But if you have comments, if you have questions, if you have topics you want to hear about, we will be telling some patient stories, because that's one of the things that really help us educate others. When we talk with a patient, they want to know, have you ever encountered something similar to this? And usually we have, and so we can give some examples, and we will, because that's a really important, helpful educational tool. But we want to make you feel more comfortable about what's happening with your body.
Thank you all for joining us today. We
Thank
look
you.
forward to continuing on this journey with you.
Yeah, our quest is to teach you more and provide that information that you need to make you feel comfortable about dealing with your health.
See you next time.
See you next time.